Hello friends, I'm Dr. Mir Asif from Miras Care Clinics. We are going to educate you today about what is the course post circumcision surgery. What does a patient expect and how does the healing process occur, and what are the danger signs and when you should go and see a doctor post procedure. Circumcision surgery generally is done by three ways. One is conventional, other is ZSR, and third is a laser circumcision. These are general instructions for all three of them. So, what do you expect post surgery? The surgical procedure lasts around 10-15 minutes, can be done under general anesthesia, spinal anesthesia, or local anesthesia. In local anesthesia, you can be discharged within an hour of the procedure. In general anesthesia and spinal anesthesia, it's a daycare procedure. You'll have to stay in the hospital for 10 to 12 hours until the effect of the anesthesia weans off. So generally, patients perceive pain for next 24 to 48 hours. And in our practice, we give antibiotics for just 2 days and give painkillers for 2 days, and then the patient has to take painkillers if and when required. Generally, the patients fare well post a procedure, and after 48 hours, rarely anybody requires a painkiller. So, what do you expect post procedure? The first thing which patient will notice is that there is going to be some sensitivity because the glans has been left without a cover. So there is an increased sensitivity. The second thing which the patient notices is the swelling of the penis. This swelling increases for first 5 to 7 days, then it subsequently starts to decrease, and the penis is of its normal size in next 4 to 6 weeks. Dressings. When should you get a dressing done? We do the first dressing. We ask the patient to keep it for 48 hours and remove it at home. The patient does not need to come back to remove the dressing, and there are no dressings required after 48 hours. So when the patient removes the dressing, sometimes patients are fearful that what is going to happen or if it is going to hurt. Generally, these dressings are done with an paraffin gauze underneath the skin, and they are easy to remove. And even if it is not used, you can just soak the penis along with the dressing in clean water, and this dressing will come off. Soak the penis for 10 to 15 minutes in clean tap water. The dressing will fall off on its own, and generally no dressings are required after that. When can patient take shower? Patient can take shower after the dressing has been removed, and patient definitely should take shower every day. What we ask our patients to put soap water over the penis and leave it there for 4-5 minutes, and then wash it off and clean it dry with a clean dry towel. And no more dressings are required after 48 hours in our practice. So medications, as I've already told you, we don't prescribe any medications after 48 hours. There are generally no medications required. What kind of food can a patient take? Patient can take normal home cooked food, preferably high protein, normal diet from the day of surgery. No special restrictions are required. No special food is required for your healing. The only thing which is required are a little bit more proteins, and you should avoid oily, spicy, and outside food. When can you resume your normal day-to-day activity or office work? Generally, after first 24 hours, you can resume your office work. There are no special prerequisites required there. This is a simple, straightforward procedure. The office can be resumed after first 24 hours. If you are in strenuous physical activity, then you should avoid that for say couple of weeks. Normal physical activity, normal walking, brisk walking can be done from a week to 10 days time. There's no clear-cut indication that you cannot do it. It is just because there is heightened sensitivity of the glands. That's why it is little uncomfortable to start doing a strenuous activity post procedure. It generally takes the patients around 10 days to 2 weeks for that sensitivity to go down, and people can resume their routine physical activity after say 2 weeks. Sexual activity should be withheld for say 4 to 6 weeks. It generally takes the penis to go back to its normal size and the wounds to heal for around 4 to 6 weeks. And generally you should use protection for a couple of more weeks, so that there is no direct trauma to the healed area. How do you know that you are healing all right? There are few signs and symptoms the way which can tell you that you are healing all right. One is that there is no significant pain. Say after 48 hours the pain has substantially reduced. Second is that the swelling is getting better every day.